Hello, everyone, and thank you for joining us today. I'm excited to welcome you for this thought leadership session on an actionable roadmap to data strategy. I'm Garima Arora, and I'm the head of marketing for NuAIg. This webinar is for healthcare providers and senior living communities. Now, data is not an optional anymore. It is a strategic necessity, yet too many organizations remain stuck with siloed database and dashboards and struggle to use data for real-time decisions. Today, we'll cut through all the noise and walk you through a practical, actionable path to planning, prioritizing, and operationalizing your data strategy with real-world insights which are tailored to your challenges. So before we begin, a quick word about NuAIg. NuAIg is an advisory and implementation firm. We are focused exclusively in the senior living sector. What sets us apart are two things. One, we don't serve any industry except the healthcare providers and senior living sector. Second, we are not general tech implementers. We are AI advisors and enablers. So our approach begins with a deep gap analysis to understand your current systems, your processes, your data, where you are and where you want to be. We design a highly tailored data and strategy roadmap to unlock value from your technology stack. You'll see a few logos on the screen. These are snapshots of the providers who we have partnered with across the healthcare and senior living sector. Been associated with NuAIg, Urgentum, and we have been invited to many thought leadership conventions and conferences to share our knowledge and wisdom. We have also published many case studies in leading edge publications. So a few housekeeping items before we begin. The session will run for 30 minutes today and followed by question and answer session. We have a chat window open, and if you encounter any of issues during the webinar, do let us know, and our tech team will handle all the issues. We'll share the recording after the webinar with all the attendees. So now I'll introduce the speaker today. Hi, Ashish. Ashish is heading the data practice at NuAIg, and he leads several data initiatives for healthcare and senior living organizations. He has a strong consulting background, and Ashish brings deep expertise in leadership alignment, stakeholder engagement, and building data-driven cultures. Beyond his professional role, Ashish is pretty passionate about history. So, Ashish, over to you.
Thank you so much, Garima, for the introduction. Good morning, good afternoon, everyone. My name is Ashish Garg, and I'm absolutely thrilled to be here with you today. And I'm super excited to take you on a transformative journey where you'll discover not just what data strategy is, but more importantly, how to build an actionable roadmap that will revolutionize how your organization approaches data. But before we deep dive, let's first understand why we all are here today. And I want to open this presentation with a powerful phrase that I believe captures the essence of our challenge, which is too much data isn't the problem, but lack of strategy is. Now, think about your organization for a moment. Are you flooded with data but starving for insights? You're not alone. Senior living organizations today are collecting more data than ever before, yet many struggle to transform that data into meaningful, actionable insight that drive real impact. So here's our goal for today. We are going to transform how you approach data from reactive reporting to strategic decision making. By the end of the presentation today, I promise you will have a clear roadmap to move from reactive to strategic. So what exactly will you learn today from this session? We have designed this session around 5 key areas that will give you everything you need to start your data transformation journey. First, we'll establish a clear understanding of what data strategy really is and why it matters specifically in senior living. Second, we'll identify the barriers that are holding any organization back to becoming a truly data-driven organization. And I want you to walk away knowing exactly what's preventing your organization from unlocking the full potential of your data. Third, we'll assess where you are on your data strategy journey today using a proven data maturity framework. You'll understand your current state and what steps you need to take next. Fourth, and this is crucial, you learn about how data is transformed into everyday decision making, not just dashboards, but what we can do with the data beyond dashboards. So if we have to look at right tools and expertise at our disposal. Fifth, we'll explore best practices in data security and governance, because let's face it, in healthcare, data protection isn't optional, it is essential. So by the end of the session, you will have a clear understanding of where your organization stands and a roadmap to move forward confidently. So let's start with the foundation and asking the most important question: what exactly is a data strategy? A data strategy is a structured plan to manage, prioritize, and use data to meet business goals. But here's what's important to understand. A successful data strategy goes far beyond buying new technology. Think of it like building a house. You need four essential building blocks. The first is the strategy layer. This is where your vision, goals, and business alignment comes into place. What outcomes are you trying to achieve with your data strategy? Are you looking to improve resident satisfaction, or reduce operational cost, or enhance care quality, or culmination of all of it? Your data strategy must connect directly with these business objectives. The second important building block is the people layer. This encompasses skills, culture, and organization. So do your teams have the analytical capabilities they need, or are they comfortable using the data to make decisions? So how will you encourage data driven thinking across all levels of organization? The third building block is the process layer. This includes governance, workflows, and standards. So how will you manage and protect information? What are your quality standards? Who is responsible for what? And the last and the most foundational layer is the technology layer. These are your tools, platforms, and infrastructure. What system will support your strategy? How will they integrate with the existing workflows? So all in all, data strategy isn't about making data useful for decision making. It goes beyond that. It's about how do you go about building these blocks. Now, why data strategy matters specifically in senior living? In today's rapidly evolving landscape, a robust data strategy isn't just nice to have, it is essential for survival and growth. Organizations that effectively leverage the data gain four significant competitive advantages. So the first and the most important one is the enhanced resident outcomes. So you can make informed data decisions, care decisions that improve quality of life of your residents, improve health outcomes. And imagine being able to predict residents who might be at the risk for falls, or identifying early signs of cognitive decline. Second is the operational efficiency. So you can go about optimizing staffing, resource allocation, and daily workflows based on real-time insights. So no more guessing about optimal staffing levels, or uh, wondering which programs are most effective. Third benefit of a strong data strategy is the revenue growth. So you can identify new services, opportunities, and optimize pricing models with things like predictive analytics. The data that you already have contains insight about unmet resident needs and market opportunities. The fourth and the last one is the risk mitigation. You can proactively identify and address compliance issues and operational risk before they even become problems. Karima, can you move on to the next slide? Right. So now let's get real about what's holding your organization back. And I want you to think honestly about your own situation as I go through these common barriers. And for the first one is siloed data. It's an undeniable fact that information is trapped in disconnected systems and departments. And you have to ask yourself a question: how many different places do you need to look to get a complete picture of a single resident? Uh, the second common barrier that we see across is the lack of executive support and strategic prioritization. So ask yourself this question that are your leaders making decisions based on data, or are they still relying primarily on intuition and experience? The third is the skill gaps. So there can be insufficient analytical capabilities within the organization. So an important question to ask again is, do your team members know how to interpret the reports or the data that they receive? The fourth important challenge is the technology challenge, which is, you have outdated systems, integration issues, or overly complex systems that nobody wants to use. The fifth and the most important one is the cultural resistance. So the we have always done it this way mentality is prominent across healthcare, and I know change is hard, especially in healthcare where established processes have kept residents safe. Now, I would ask you to take a moment to identify your top three barriers and what are the specific steps you think would help overcome them. And I would love to see your responses on the chat. Perfect. Now let's move towards the main part of the session, which is the pillars of data strategy. And we at NuAIg strongly believe that there are four key areas within the data strategy. First, it's absolutely critical for an organization to understand where they are at their data journey. Assessing your current data maturity level is the very first step towards building a data-driven organization. Second, and this is an important one, is embedding data in everyday workflows. So it's not just about creating dashboard and take data-driven decisions, but also inculcate right culture such that it becomes easier for an organization to scale to a truly data-driven company. The third and the most important one is the future proofing your organization by building a scalable and flexible data architecture. The last and the obvious one is to ensure safe and compliant data usage. We'll look at each one of them in detail in the next subsequent slides. Right. So this is the first preliminary step towards a data strategy. Understanding where your organization currently stands is critical for charting any organization's path forward. So let me walk through our maturity data framework specifically designed for senior living organization. So stage one is the very first stage, the beginning stage. This is where you have siloed data and the IT is just working to keep the lights on. The second stage is the developing stage. You have some dashboard or limited integration. There's an effort to bring data together, but it's still largely manual and reactive. Stage three is a defined stage where you have some level of standardized reporting and you are now generating insights. Your data processes are now more systematic, robust, and you are starting to see patterns. Stage four is an advanced stage where you have integrated analytics and predictive capabilities. You are not just looking at what happened, you are also forecasting what might happen. Stage five is the most advanced stage where you have a truly data-driven culture with automation, AI, and data informs every major decision and insights which are automatically generated and acted upon. So regardless of what stage you are currently today, the forthcoming slides will give you a comprehensive idea based on your maturity level. What are the next steps you should think towards moving to a data-driven organization? So the key question to ask again, where does your organization currently stand? And be honest with yourself, this assessment will guide everything else we discussed today. Right. Let's move on to the second fundamental step to become a data-driven organization, which is inculcating habits and embedding data in everyday workflows. So here's where the rubber meets the road. Data is only valuable when it's actively used in daily operations. And too many organizations we have seen stop at creating beautiful dashboard that not many people actually uses to make decisions. So moving beyond occasional reports uh, to embedding data in everyday workflows by transforming organizational culture and decision making. So here are four implementation strategies that can work. The first is to create a data champions network. So you have to identify and empower staff members who understand both data and operations, and these champions will drive adoption across departments. Second is to redesign workflows. So don't just add data into existing process, evaluate current workflows and identify specific points where data can inform decisions and actions. Third, and an important one, is to provide role-specific training. Focus on applying data insights rather than just accessing dashboards. Show people how data helps them to do their jobs better. The fourth and the most important one is to establish feedback loops. So, you as an organization, you can create mechanism for staff to share how data is helping them or is the data hindering their work. You can continually refine your tools based on this feedback. Right. Now, let's talk about building a future-proof data foundation by building a scalable and flexible data architecture. And we have seen this is where most organization gets overwhelmed, but I'm going to simplify it in a very, very simple language. So you can think of your data architecture like a restaurant kitchen. You have ingredients coming from various suppliers. That's your data sources like EMR, CRM, billing systems, etc. You need a place to store these ingredients, and that's your data warehouse or data lake. The next step is you need preparation areas where you can clean, combine your ingredients. That's your processing layer. And finally, you need ways to serve the finished dishes to your customers. That's your analytics and user interfaces. Right. So when you look at the complete picture of a data pipeline at a higher level, one of the basic things is to bring together data from multiple sources to a warehouse or a lakehouse and then run operations to refine and clean the data and achieve the end result. But the right data strategy is to go deeper and understand the source systems better, understanding the access points, ingestion methods. How will I store my data? Where will I store my data? Will it be a data warehouse or a data lakehouse? And at the end, what do I want to do with my data? So let me walk you through the practical steps for the step one, which is auditing and strategizing your data access. And it's extremely important and prudent to audit your source system and strategize data access and ingestion points. This acts as a base layer or a foundation to set the right data strategy in motion. So the very first step is to classify your source system by type and priority. You can classify the source system based on some attributes such as system type, what kind of data sits in terms of criticality, what is the update frequency, and how data is being stored and structured. The second step is to identify access methods. Map each system to the most efficient access method. Some systems offer APIs, other require file exports, some might need direct database connections. So this step helps us to identify the complexity involved into accessing data and helping stakeholders to clearly identify the type of data one wants to fetch in. Step 3 and 4 are choosing your ingestion technique and designing the ingestion schedule. So determine how frequently your data needs to get updated. Will it be updated real time for critical alerts? Will it be updated for near real time for admissions? Will it be updated in daily batches or weekly batches? So it's very important to identify your frequency of data updation to design the right ingestion schedule for you. Right. So once we have audited the source system, identified the access methods, designed the ingestion schedule, the next part of the story is to identifying and designing the right data storage strategy. So there are 3 common storage tools or methods that are used across the industry. And the usage and selection of these tools totally depends on how your data architecture is built today. So it can vary from company to company, use case to use case. So the first storage method tool is a data lake. A data lake can store tremendous amount of unstructured raw data. And if you are an organization who have huge volumes of unstructured data, but no immediate plans for further data processing, you may opt for a data lake. The second data storage method is a data warehouse. So a data warehouse has a low to medium data storage capacity, and it stores structured data. So there are two cases where data warehouse can be a right choice for you. First, when you have structured data built already and you want faster dashboards on top of it. Second, you have data lake already in your data architecture pipeline and you want analytics layer on top of it. The third storage method is the most common, which is data lakehouse. So it is combination of best of both worlds. So you can have both structured and unstructured data in data lakehouse, and it can also store huge volumes of data. So if you are someone who is just starting out and want flexibility to grow in the next 5 years and have an aim to build the AI layer on top of it, then data lakehouse is an absolutely right choice for you. Right. So once we are done setting up the basic components of data architecture, the last and final step is to identify what to do with my data now. So we at NuAIg recommend companies to take small incremental steps. We don't want you to directly jump on level 5, say when you are at level 2. And we can see on this slide, we can have different level of data and usage from level 1 to level 5. And it is somewhat related to at what maturity stage your company is. So let's go level by level to understand each one of them. The first level is the basic visualization dashboards. So these are the kind of dashboards for tracking KPIs across your line of businesses. And this is where most organizations begin typically. So we recommend organizations who are at maturity stage 1, they should start from here by building basic dashboards and tracking KPIs across LOBs. The second level is the advanced visualization dashboards. So these are more sophisticated KPI heavy dashboards and executive level insights that help you understand trends in detail. So any organization who has started to build dashboard and is at somewhere at data maturity stage 2 can look forward to create sophisticated KPIs dashboard and deriving executive level insights. The third level is the predictive analytics level, where you forecast key outcomes like census trends, health risk, and operational needs. So any organization who is at level 3, where they have their reporting, visualization, KPIs, and everything sorted, they can look towards at a higher level of predictive analytics. I can start experimenting with the predictive analytics. Level 4 and level 5 are smart agentic models and LLM integration. So, agentic model, as you know, assess context, set goals, choose from available actions, adapt over time. And LLM are, the custom LLMs which integrate with your organization data and enables conversational access to insights, document summarization, intelligent search, etc. So we recommend any organization who are at level 4 and level 5 of their data maturity to start experimenting with these advanced level technologies by building smart agentic models and LLM integrations to achieve the most advanced level of data sufficiency. So the goal isn't to jump straight from level 5. It is to progress systematically through each stage by building capability and confidence along the way. Right. So at last, let's address the elephant in the room, which is data security and compliance. So in healthcare, this is not optional. It's absolutely critical. So senior living organization must balance tremendous value of data with stringent compliance requirements. So any organization need to properly implement security and governance framework for both regulatory compliance and stakeholder trust. So the key elements that you must address are, first, a very common HIPAA compliance. So as an organization, you should implement technical, physical, and administrative safeguards to protect PHI and ensure resident data privacy. This isn't just about technology, it's about processes and training. Second is the access controls. As an organization, you should have a defined role-based permission, audit trails, and authentication protocols in place. So people should only access the data they need for their specific roles. Third is the data privacy policies. You should stay compliant with the evolving state and federal regulations like CCPA and GDPR while maintaining transparencies with the resident and families. The fourth and the last one is the governance framework. So you should establish a data governance committee with clear roles, policies, and procedures for data stewardship. So someone needs to be responsible for those decisions. So here's the best practice I want you to remember. So as an organization, you should review your data governance policies at least annually to adapt to changing regulation and organizational needs. We all know that the regulatory landscape is constantly evolving and your policy needs to evolve with it. Right. So this brings us to the end of our presentation. To conclude the key takeaways, I want to reiterate 5 important things that we talked about. First is, as an organization, it is extremely important to understand where you are at your data maturity level. It helps us to assess the next steps, the next immediate step we should take as an organization. Second, we should identify barriers that prevent you from any data-driven decision making. Third, we should inculcate right habits and try embedding data in everyday workflows. The fourth and important one is to build strong data foundations by diving deep into understanding each step of data pipeline for scalable, future-proof data systems. And at last, we should have a secure and data governance policies in place. That's all for the presentation. Thank you so much. Garima, you can take over.
Yes, thanks. My screen is shared, so I just received a few questions from Shravani. So the first question that one of the member of our audience has asked is, how do we measure the success of our data strategy investment and what KPIs we should be tracking?
Okay, I think it's a great question, and from our experience, we recommend tracking metrics across 4 categories. So the first one is to the operational efficiency part, where you can track KPIs such as time saved on manual reporting, reduction in data errors. Second could be a financial impact kind of category where you can track KPIs such as cost savings from process automation and something like that. Third can be from quality outcomes, where you can track metrics such as what is the resident satisfaction scores, what are the incident reduction rates. Fourth category can be from a cultural adoption point of view, where you can track percentage of staff using data tools regularly. So according to me, you can track this progress monthly, and I believe most organizations start to see the measurable improvements within 3-4 months, as long as you are tracking these KPIs coherently.
Okay. Thanks, Ashish. I got one more. How long does it typically take to see real results from a data strategy implementation?
Okay, I think that's a great question again. It is subjective, I would say, and it depends on your starting point and scope. Also, it depends on which stage of data maturity level you currently are. So a rough ballpark figure to reach at advanced data capabilities can be something in the range of 12 to 24 months.
Thanks. One more question that, can I get a copy of presentation? Yes, we'll share it with you, Anne. Okay, I think we can just wrap it up here. Ashish, thank you so much. And we'll just reach out to us on a website or on the email ID if you need to schedule a free strategy session. We'll be happy to assist you. Thank you so much, everybody, for joining us today. Have a great day. Bye-bye.